down. She done.
Look, I got things to do. I gotta go to lunch.
Thank you. That lady gotta go. Wait, Meltress, just calm down. Just relax.
Wait. The currently circulating coronavirus, which we've all become very aware of in these last few weeks, is a brand new disease to human beings. It had never been seen before. And in December, there were several cases of human illness among people in China who worked in or near live animal markets in Wuhan, China. So the first number of cases went from animals, we believe, to people. They crossed the virus jump species. However, soon thereafter, the virus, the coronavirus, started to spread from person to person and did not need an animal in its transmission. It was going directly from person to person. Coronaviruses, there are many different coronaviruses. A coronavirus causes the human cold, for example. But different coronaviruses, including the one that caused SARS about 15 years ago, and other diseases, these are brand new viruses and therefore can spread very, very quickly. People do not have immunity because we've never experienced the disease before. And so many cases can occur. Epidemics are what the term that you use when there are a number of cases of disease that exceed the expected number of cases. And so since we've never seen this coronavirus in people before, it automatically then becomes an epidemic. Pandemics are when these infectious diseases can actually spread very quickly across the world in different countries. And of course, as we're talking about this today, there's a large number of cases in China, but cases have also been identified in over 20 countries, which is why the World Health Organization declared it a global public health emergency just within the last few days. I think people are very concerned because it's brand new and it's never been experienced or seen before in humans. And so there are a lot of unknowns. For example, how many people are infected with the virus. We see the counts that the World Health Organization posts and that are in other news reports. But for example, in China now, there are approximately 12,000 cases that have been reported, but there may be other people who are infected with the virus who maybe are not ill or severely ill. And so there could be many more that we're unaware of. And if they develop a fever or any respiratory signs or symptoms, they should contact their health provider and making it known that they actually know somebody who has just returned from travel to China. We'll just have to see how this virus continues to behave and whether we start to see increased numbers of cases in these other countries. Viruses know no border. And so any measure, for example, in China, they are taking steps to try to find ways to limit large numbers of people coming together. A higher risk on a just day-to-day basis in the United States anyways is seasonal influenza, for example, where there are millions of cases and 3% of people infected with influenza actually develop real serious illness and can go on to die. So the risk of influenza for the United States population presents a higher risk than does the coronavirus. So unless there are any contraindications, people should do everything they can to get their flu shot to prevent exposure that way. But with regard to this coronavirus, because the risk is so very, very low, there really are no extra precautions that are needed. There's nothing about this where people should panic or become overly concerned. The local public health authorities are doing a great job at detecting and becoming aware of people who have been infected and who might be ill, and then their contacts and following them and testing them. There's a laboratory test that can be done to see if the cause of a person's illness is this new virus. And so local public health authorities and then nationally the Centers for Disease Control and Prevention are doing a great job of looking and detecting case of illness and then following up to make sure that they do not spread the disease to anybody else, and then following up with their close contacts to make sure they don't become ill and transmit it further. So far the control of this has just been phenomenally good. So people should be proud of their public health authorities and then do everything they can to stay healthy in a general sense.
Scrub harder. Harder!